My name is Dr. Irwin Goldstein. I am Director of Sexual Medicine at Alvarado Hospital in San Diego, California. This is the 10th in a series of educational videos on the subject of penile revascularization for young men with erectile dysfunction. This 10th video will again focus on the subject of bicycle riding associated erectile dysfunction. This may be caused by a blocked artery to the erection chamber that occurs while bicycle riding on a narrow saddle with a long protruding nose. This 10th video will feature an edited interview with talk show host Geraldo Rivera on the subject of bicycle riding erectile dysfunction. This 10th video will also feature 3 young patients who underwent penile revascularization for bicycle riding associated erectile dysfunction. 2 questions were asked of these patients. Question 1. How did you develop bicycle riding associated erectile dysfunction? Question 2. What were the results of your penile revascularization surgery on your erectile function? I hope you enjoy and learn from the experiences of these penile revascularization patients. It should be emphasized that while these patients all realized marked improvement in erectile function post-penile revascularization surgery, our experience with over 1,500 such surgeries is that 2/3 of men will achieve excellent post-operative erectile function results.
Numbness and tingling, either while riding or while sitting on the bike, doing my job, talking to people, whatever it may have been. And then it progressed started getting more into my personal life. I started, noticing every now and then, problems with an erection.
Dr. Goldstein says modifications in a standard bike seat will not do the trick. His radical approach insists any seat that requires the rider to straddle the bike is still a danger. Just how dangerous?
The fact is it's 4 or 5%. So 95% of bicyclists will not get this. Are you willing to take that chance?
No. I'm glad I ride a Harley with a great big fat seat. But Dr. Irwin Goldstein joins us live, the chief urologist at BU Medical Center. He's the physician with an engineering degree. First sounded the alarm about bicycle seat dangers 3 years ago.
Thank you for putting this on the air. This is a very important health problem. And it's very important that we have the time to share just basic anatomy and basic physiology.
Do it briefly in this segment, then we'll go to commercial. But
okay,
quick,
well,
what's your point?
The point is when you straddle the perineum, you're sitting on very important structures that relate to your sexual organs. That's the major point. This, anything that has a nose extension, I don't know if you can see this on TV, this nose extension will force you to straddle, S-T-R-A-D-D-L-E, which means you don't bear your body weight on your sit bone, you bear your body weight on the connector between your sit bone and your pubic bone. The penis is connected to that connector bone. So if you have the opportunity to have a nose extension, you will sit on it and you will straddle and you will hurt yourself. That's the problem with that seat.
Former bicycle cop who used to spend 6 hours a day on a traditional bike saddle. He became a patient of Dr. Goldstein's. What did you have? Joe, you had numbness, you had tingling, and then you had impotence, right?
That's correct.
All right, so tell me what it took in your case to fix it and whether or not you think the new seat works.
Actually, I haven't tried any of the new seats. Since my surgery, I haven't been riding. But
tell me what your surgery entailed.
I actually had an arterial bypass to actually to go past the point where the damage was done caused by bicycle riding.
What effect did it have on your whole life?
Prior to the surgery, life was miserable. My home life was up in the air. And after a 5-year relationship, and things were really tough. Since the surgery, we've gotten back onto an even keel, and we're progressing on with a normal life. We finally got married a couple of months ago, and
congratulations. But how long did it take you, Joe, to realize what the hell was going on?
Probably about 3 months or so. Yeah, it took about 3 months or so, as it just gradually progressed to the point where the problem got so bad that I started in with my general practitioner, moved into a local urologist, and who in turn referred me to Dr. Goldstein.
Let me ask you a question. Did you feel sore riding the bike?
It wasn't so much sore. It was just numbness and tingling. That it was like your foot fell asleep. Unfortunately, it wasn't my foot that was falling asleep, and I didn't understand what the problem was.
I want to go back to Dr. Goldstein. Lots of people have bikes. Now, a lot of people are going to be scared. A lot of men are going to especially be shaken up after seeing this. Are you advocating not bike riding
Listen,
putting the bike away?
It's a risk. I mean, you know, you can smoke cigarettes and you can not necessarily get the risk of lung cancer, but you could get lung cancer. This is a risk of erectile dysfunction. I'm a practitioner of patients with sexual medicine.
Like 12 years old, I read a book when I was a kid about a group of people who rode bikes cross country, and I had it in my head since I was a kid that I was one day going to do this. And so one day I was walking down sort of the main thoroughfare of my campus, and somebody came right up to me. They had like a table set up, and they said, "Do you want to ride your bike cross country?" And I said, "Actually, yes. I've been meaning to do that." So I got set up with this group of people who were planning a bike trip from Philadelphia to San Francisco to raise money for the American Cancer Society. So that summer, it was the summer of 2005, we were on the bike. As I said, we started in Philadelphia. We were on the bike for 6 to 10 hours a day, riding day after day. And I sort of noticed it on the trip that I just wasn't having spontaneous erections, just wasn't experiencing them at all. But I chalked it up to the fact that I was doing something that my body had never done before. It was something more intense physically than I'd ever done before. And I thought, you know, I'm burning more calories than I've ever burned before. I'm sleeping in a tent every night. It's probably just being in weird environments. But when I got home and I got back to school, that's when it sort of became alarming that I wasn't having spontaneous erections. And more than that, when I was finding myself in a situation, you know, with a girl or even by myself where normally an erection would just occur. I wouldn't, again, something I wouldn't have to think about. It wasn't. And that is when I started to become alarmed. So I would say it was really as soon as I got back from the bike trip.
So from 2006-ish to 2008, you were not having your normal erection function.
That's right. Yeah, it would take longer and more stimulation to get erect, and then once I was erect, it was not as solid as it was before the bike trip. The second you gave me the green light to go ahead and resume regular activity, it was like night and day, Dr. G. I knew right away that it was better. And at this point, I'm back to where I was before the bike trip.
Fabulous.
Yeah,
fabulous,
so
fabulous.
I went from normal functioning young man to a not functioning at all young man back to completely normal, which, I mean, it's basically...
It's magic.
The dream come true from those 3 years when I was not well functioning. It was amazing that you can be, life is going down one path, and all of a sudden you wake up one day and something seems wrong. Where mine had started was, I had competed in an adventure race. I was getting ready for triathlons and whatnot, and doing a lot of training, running and swimming and biking. And specifically, I got into an adventure race. And during that adventure race, I was competed on a road bike. And it just so happened I had to borrow a buddy of mine's bike. And sometimes something happened in the middle of the race that it was very strange. I guess, something like knew something was wrong when you're as healthy as I was. And I've never used drugs. And at that time, I wasn't drinking a lot of alcohol. So I was really in tune with my body. And so at the end of the race, I basically became numb in my genitalia. And so becoming numb, I was like, oh, this is awkward. And I'm talking to quite a few of my friends who were other triathletes and cyclists. And, they made a joke, oh, that's what we call Mr. Numb Penis. And I was like, I've never heard of this. And so apparently what happens and what I learned over time is that, you end up putting pressure due to a bicycle seat, possibly not fitting you correctly, can put pressure and possibly cut off blood flow for a little while. That nerves are a little bit damaged, but eventually would come back in a week, few days. Well, as time went on, over a number of days, and weeks, and then months, all of a sudden the numbness wasn't going away. So that's where I kind of became, noticed that something's really not right, and where I started my journey in trying to determine possibly what was wrong with me. Sometimes, even within the week of having, the surgery, you're immediately having an erection. As time's gone on, I would answer say they're just the same as they were before I ever got injured.
Wow.
It's that's a things to where, you just casually, wake up in the morning one day and you have an erection from the night when you're sleeping, and you're like, I don't feel like I've lost anything. And that's what the amazing part is. I mean, I think there's a period where your body
That's
So
fabulous. That's
I would say that
unbelievable.
I don't even notice a difference. If I wouldn't have known that I had the surgery and have one little small scar for where, you know, my incision was, I would have no clue that anything ever changed.
I was just a casual bike rider. I enjoyed it. I did, you know, both mountain bike riding and street bike riding. And, you know, it was a lot of fun. It was kind of an endorphin rush and always a good workout and everything. But it led to me making a decision to do a century, a 100-mile bike ride. And this particular one covered 3 states. There was a corner of Georgia, Tennessee, and Alabama, and there were 3 mountains in each of the states, and it was a big challenge for sort of my 40th birthday, which happened that year. So I entered that 3-state, 3-mountain challenge and rode the 100 miles, was on the bike seat about 6.5 hours, and then really didn't think anything about it until that was on a Saturday. The Tuesday after that, the first time my wife and I tried to have sex afterwards, and I didn't have a full erection. And we were kind of both like, what's that all about? And she immediately knew it was related to the bike riding. I didn't want to think that it was, but it prompted me to go to the urologist there in Atlanta where I lived. And when I went, he said, no, I don't think it's related to bike riding. He was a bike rider himself. He said, you know, guys go through this. It's generally psychologic. We'll put you on some meds for a while and you should be fine. And so, you know, kind of had that question in my mind, but I continued to ride, mostly just mountain bike riding, and, you know, sort of waiting for things to get better, which they didn't. And then that, over maybe 3 or 4 months period of time of no improvement, finally led us to Boston to see Dr. Goldstein. I would say I'm 90% plus. You know, some of it I'm not sure is not some age related. I'm 51 instead of 40 years old or 30s, you know, and so, you know, maybe, you know, my erectile function is not quite what it was, but I would say as far as firmness and capability and whatever, it's 90% plus, because I don't have to take medication in order to have sex and have, you know, a good erection. I know that, you know, I can't have it 3 times in a day, maybe, but, you know, I'm not, you know, where I was in my 20s or 30s, but I can take medication and I can do that, you know, and so medication can make you feel like or perform like you're in your 20s again. And so I do that on occasion, and then on occasion, and I should be more consistent about taking it just routinely for good penile blood flow and encouraging that. But, you know, it seems that I'm at least 90-95% of where I was prior to the injury.
In summary, this is the 10th educational video on penile revascularization for erectile dysfunction. I wish to thank Joe, a former bicycle riding policeman, for talking about his experiences with erectile dysfunction on national TV on the Geraldo Rivera show. Wish to also thank the 3 patients who were interviewed, TJ, Jason, and Randall. Thank you, thank you, thank you. It is not easy to do this, and you are all greatly appreciated. Here are 4 take-home messages for video number 10. 1. Bicycle riding erectile dysfunction is a very important health problem that is under-discussed. Even Geraldo was unaware of this. 2. Bicycle riding on a narrow saddle with a long, protruding nose extension can cause, in some riders, a permanent crush injury of the artery to the erection chamber that lies between the narrow saddle and the pelvic connector bone. 3. This erection artery blockage can cause unwanted and unhappy sexual experiences in young men. 4. In some patients, penile revascularization surgery can restore sexual function in these patients. Thank you for listening.